Okay, people are joining. We're going to get started in just a second. There you are. All right, so I'm going to make you let's, all right, and you can unmute yourself, and there you are.
Hi there.
Welcome.
Can you hear me okay?
I can hear you just fine.
Okay, great.
How are you?
I'm good. How are you?
I am doing well. I'm doing well.
Wonderful.
We've got about a dozen people here with us, maybe more, and a couple people have asked some questions that we want to get to over the course of this hour. And so we're going to go ahead and get started because it's 5 o'clock here in Chicago. What time is it in Durango?
4:01. So we get one less minute than you.
Nice.
I'm kidding.
I am Dr. John Stracks. I think everybody knows me. I see a lot of our current patients in the queue here. And Michelle, why don't you introduce yourself real quickly?
I'm Michelle. I'm a PA working with Dr. Stracks, who's currently in Raleigh. I don't know if you noticed that. Who's a key part of our team as well. I'm a yoga therapist and I do coaching with Core Mendy, and I focus on somatics. So that's a little bit about me. I also work in orthopedics besides mind body medicine.
And for those of you who don't know, Michelle was a plastic surgeon. Did you already say that? Plastic surgeon?
I didn't say that, but yes, that was my history. That's actually where Dr. Stracks and I met when I was in my my plastic surgery practice there at Northwestern. I was there for a decade. It was wonderful. I did breast reconstruction predominantly, which was wonderful.
Yeah. And so we're here tonight, talk a little bit about mind body medicine and our practice, and to answer some questions that you might have, those of you who are listening. And so we're going to try to split it about half and half. And so we'll talk for about half an hour. Michelle and I want to talk about some of the work that we do and how the practice runs. And then we've budgeted half hour if people have questions. And so if you do have questions listening at home, there's a Q&A button that should be at the bottom of your screen in the webinar. So feel free to click on that and send questions. Those will pop over to our side. We'll be able to see them, and we'll answer as many as we have time for over that second half hour. And so this webinar is part of an ongoing series. We, over the years that we've been here frequently, have offered these once a month or so, just an opportunity for our patients to get a little bit of extra information and ask some questions. And we want to do it because we appreciate our patients and want to give as much information as we can, and also get the word out about what we do and how we do it. And we work hard to help people recognize that pain and chronic symptoms have different solutions than just medication and surgery and procedures. And so we want to talk about that as much as we can. Michelle, you and I have both shared our own personal stories in various places. And so you and I talked about your story on one of our Hope for Healing video casts, and I've recorded my stories on a variety of podcasts, including Like Mind and Like Body, which is associated with Curable. And so we don't need to repeat those here. For those of you who are interested and haven't heard them, those are all available on various spots on the internet. You can hear all the Hope for Healing recordings through our website, drstracks.com, which is where we're keeping those recordings and new blog posts that we have been creating. And so rather than talk about that tonight, I want to talk a little bit about what makes our approach different than a lot of other approaches out there. And so, Michelle, my first question for you is, when you were in PA school, did you ever hear in any class that if somebody had a symptom, it might not be due to a physical problem?
Zero. Pretty sure I never heard that. What about you? Oh, you
No.
were in a training after that probably talked a lot about that.
I have done lots of training after medical school, but in medical school and residency, there was not a lot of discussion. And so,
Mm,
people have heard me tell whole varieties of my story. One of those is that, by the time I got to medical school, I knew about all this. I'd had my own experiences with it. And I thought I'd be just like, I'd tell everybody like this is the nature of pain and everybody will get better and everybody will be really happy and it'll be easy. And so I saw a patient in the emergency room. It was like literally the first real life patient I had ever seen. And she was there in the emergency room with back pain. And I said, "Oh, it's anything stressful going on?" And she's like, "Well, I mean, I called my boss a racist yesterday,
oh,
and so I'm expecting to get fired tonight." I was like,
mhm.
"Well, that sounds stressful." And we talked about it. And then I went back to the attending physician and said what she had told me and what I thought. And he just looked at me like I was completely insane. Like I'll never forget the look. And finally
Mhm.
he's like, "Did you look at the MRI or did you not look
Right.
at the MRI?"
Uh-huh. Like a move on.
Yes. Yeah.
Let's get to the important stuff.
Right. And
Right.
the important stuff question, and this is another story that's out there. Dr. Clark, who's a colleague of ours in Denver and used to be in Oregon, is gastroenterologist. And so he has this story where he was referred a patient because he was known as sort of being able to help people who had GI symptoms that didn't have other solutions. And she did all kinds of tests and all kinds of procedures. And so he interviewed this woman and it turned out she was in an abusive relationship.
Mm-hmm.
And he got social work involved and helped her out, and the story had a happy ending. And he messaged back the referring physician and told the referring physician what he had found. And the referring physician sent him a message back saying, "Oh, that's I'm grateful to know that I didn't miss anything."
Ah, ah, that's in some ways heartbreaking, right?
Isn't it?
Because
Isn't it?
that's completely what changed her wellness, right?
Right.
So that's,
Right.
it's just
And
such bad
so
messages sometimes.
Right. And so the physician didn't miss anything if the only thing physicians need to look at is physical abnormalities.
Right.
If you
Mm-hmm.
don't, if you feel as a physician or as a PA, like it doesn't matter what's going on in people's lives, then, right, well, then medicine's easier because you don't have to pay attention to things like that. But
Yeah.
but you eliminate sort of this whole range of possibilities in helping people to heal.
Yeah.
I was thinking of another story recently for whatever reason. When I was a resident, I was on call one night and a woman who was part of our practice had come to the emergency room 4 straight days with a headache.
Mm,
And and so I told this story in the morbidity and mortality conference, not because like it had a bad outcome, but just sort of a discussion of the medical system.
mm-hmm.
And and so she'd come to the emergency room 4 straight days with a headache. They had given her medication and sent her home 3 times. And then on the fourth night, they called me on call and said, "We want to admit her to the family medicine service." And I literally said on the phone, I literally said to the resident in the emergency room, I said, "What do you think I'm going to do for a headache that the neurology team has not already done 3 straight days?" And he's like, "We can't send her home the fourth day. She's coming into the hospital." And what I found out almost immediately, like within an hour, is that in the community where you're from Detroit, so in Ypsilanti, there had been a big
Mm-hmm.
fire in Ypsilanti the year before, and a couple of people had died. And she was related, I looked through her chart, she was related to some of the people who had died. This was the first anniversary of the
Mm-hmm.
fire.
Oh, yeah.
And and so again, like the next morning, we gave her some medication that night. She slept. The next morning, we talked to her very briefly about it. She went home, didn't
Mm-hmm.
come back to the emergency room. And so if the only thing I can do as a physician is pay attention to the physical problems or the physical solutions, which medication can I give that the neurologists haven't? but there's so much
Right.
more.
Yeah, and what you're sharing makes me think a little bit about, I think some physicians probably have a sense for that, right? They'll sense that something's going on more with this patient than just what their X-ray shows or MRI shows, for example, in orthopedics.
Mhm,
But they're also relatively not well equipped to handle it.
mhm,
And I
mhm,
think
mhm,
I had maybe told you this story in one of my like pain journey stories, but I went to see this doctor. It was the third doctor I'd seen for my foot. And he told me this story about he's like, it's like you got a new Mercedes and you drove your Mercedes to the store and then you parked it and it's just this beautiful, lovely car and you love it. And you came out and had been keyed. And I was like, you're relating a Mercedes getting keyed to my foot and I feel like it's taking away everything I love about my life. And so he was trying to speak to like, you're really anxious about this.
mhm, mhm, mhm,
But
mhm,
all I felt like he did was minimize how important this felt to me,
mhm,
which made me want to battle more. Like, this is incredibly important to me.
mhm.
Um, and I just got more angry and I just felt more stuck. Like, you think this is a Mercedes being keyed? I feel like someone took away all of the tires of my car and it's up on cinder blocks, right? Like,
Mhm, mhm,
that's
mhm.
how it felt. And it didn't help. But he knew there was something there. But it was basically the message of like you've got to be okay with not being okay. And
Mhm.
I think that message at some point in healing becomes helpful, right? If there's kind of an acceptance part,
Mhm.
but it completely misses the fact that I am a whole person, not
Mhm.
just a foot,
Mhm.
not
Mhm.
just a machine like a Mercedes that could
Mhm.
have a scratch in it.
Mhm.
And it was so impactful to me what was going on in my body. And there
Mhm.
was no care for how impactful it
Right,
was for me.
right.
Um, so there's that too, right? Where we don't really necessarily have the skills,
Mhm.
or the clinicians haven't really been taught
Mhm.
how to
Mhm.
care for
Mhm.
someone rather than just care for their anatomy or their physiology.
Right. And so many people go to school to be a PA or an NP or a physician, and because they care, because they want to care. And then the system is
Yeah,
really hard to do that. I hear a lot from people who are practicing at the
yeah,
moment. And so
yeah.
and so you went through the medical system as a patient, you went through as a practitioner. As a patient, did anybody ever explain that your foot maybe wasn't the result of a physical problem?
Well, and here's the thing, and this is, I think everyone has their own journey, but I mean, I do have arthritis in my foot, right?
Mhm,
But
mhm,
I've also had pain-free time. So, and lots of time, I would say, most of my time. And at that time, that was not the case. My pain was really, really high. So there was really just no acknowledgement that they're not directly related, which I think is such an important point about pain versus any anatomic finding. I
mhm,
work
mhm,
with a lot of people with arthritis, and I work with people who have arthritis where you really know they've got loss of cartilage. Even on an
mhm,
x-ray you can see
mhm.
it pretty
And
significantly.
how would you define arthritis in this way, right? Because it gets thrown around a lot, and I see a lot of
Yeah.
people in my office like, I have arthritis. What can we do about it? So, how would you define that?
Well, arthritis really is the loss of cartilage in a joint.
Mhm,
Um, the thing that's interesting about arthritis is I think you'll hear things like arthritis is just a slowly progressive disease. There's no way to reverse it. And then that gets translated into your pain is going to slowly progress and there's no way to make it better.
mhm,
But it's just not true, right? I see people with really bad arthritis with very little pain. I see people with very little arthritis with a lot of pain. And so you just know that there's way more to it. And
mhm.
that's not anything I heard from any of the providers I worked with, for sure.
And then how did you start to sort that out? I was thinking, like, how did I start to understand that? How did you start to understand that both in your own personal experience and as you're working with patients?
Yeah, I kind of think of this in two ways. The first is that pain and physical findings are not always directly related. So that I figured out when I had this pain-free period after doing a certain type of yoga, which I have talked about in one of my other interviews. So I
Mhm,
won't spend too much time on that. But the other thing too is that physical symptoms can show up when there's actually nothing physically wrong with the body.
mhm,
And the first experience I had with that was IBS. And I went into a naturopath and we did like every test you could possibly think of. I did this crazy elimination diet. I had SIBO, I had leaky gut, I had all the things.
Mhm.
I did everything she said. I took all these supplements, took all these things out of my diet, no shift. Then I broke up with my boyfriend, went away. And we were having trouble at that time. So
Mhm.
it totally made sense when you look back on it. There was really nothing going on with my bowels that needed to be fixed. It was just me. It was my emotional wellness. It was my sense of safety and
Mhm.
comfort and just being okay,
Mhm.
basically.
Mhm.
And once I figured that out, it went away,
Yeah. And
like
then
completely.
which is amazing, right? And
Hmm.
that's a hard one, right? Because I rarely want to prescribe a breakup to my patients.
Sure, sure.
And yet
Hmm.
sometimes I do see that the relationship, I mean, relationship is its own category of stressor that can cause symptoms in people.
Yeah.
And you and I think about symptoms as being the brain's detection that there's danger present,
Hmm.
and relationships can be a big source of danger in a whole variety of ways. Sometimes even when they're good relationships, there's
Yeah.
aspects that are dangerous.
Yeah.
Um,
Hmm.
and what have you seen about your patients? How do you have a sense of how they start to make that shift to understanding that physical symptoms don't have to mean physical problems?
Yeah, that's so interesting because I think this parallels a lot of my own experience too. And I'd be curious what you see in our patients. But I think repetition, to be honest, right? So I think I kind of got through the foot thing, figured that out. IBS was a whole new thing. I was like, I got to do all this stuff for my diet. I went through the whole thing again.
Mhm.
And then I
Mhm.
was like, wait, I know this. And then I've done it again with dizziness.
Mhm.
Um, and so each time I do it a little less, but I think it's really the repetition. It's saying, whoa, okay, wait, this is a new symptom. Here comes the response I'm really good at, which is getting really fearful of the symptom or something might be wrong.
Mhm.
And then working with that first rather than jumping into all the diagnostics, which I know just make things worse. But
Mhm.
but I think that's how it happened with me, repetition. And then that's what I see with people that I coach more regularly.
Mhm.
Um, is that yeah, we got through that. And wait, but now there's this. And I said, well, let's think about it with the framework we know. We need to remember the framework we know about pain and chronic symptoms. And then we do it again. And then maybe after a couple times, they'll come to me and say, oh, this thing happened. And I think it's related to something emotional, something stress related. So it
Mhm.
happens. I've seen it kind of happen slowly with repetition. I don't
Mhm.
know. What do you see?
Well, and that's interesting to me because there's a lot of information out there these days about the kind of work that we do and the mind-body connection, whether it's Dr. Sarno's books or Curable app or other of our colleagues' podcasts and books, and and a lot of like the original literature, say Dr. Sarno's physician in New York who did a lot of this work, like every story in there is 2 sentences long. Like I explained the concept of pain
Right.
and they never had it
Hmm.
again. And so there's always been
Hmm.
this idea, I think, or at least people who come to see me, that that's how it works. Like you understand it
Yeah.
and you're better. And even like my own experience is interesting because like I had all these pain symptoms and nobody could figure them out. And I reread this concept. Like, oh, I think I understand it. It was really powerful experience in the course of 24 hours. And then for years I would say like, and then I was better. But then like I was preparing for a talk a few years ago and I found the journal that I kept in the aftermath of that 24 hours. It was like 3 or 4 months worth of doubt and
Hmm.
worry and is this right? And who do I need to see and how do I figure it out? And so
Yeah.
I do think that it doesn't happen overnight. And even when it
Hmm.
does happen overnight, frequently like something else will pop up um, and people have to get reminded about it.
Yeah, and I think too, I know we were going to talk a little bit about either kind of like yoga or somatics. And I think sometimes too, I talk about peeling the layers of the onion, right? Where like the logical understanding might have been the first layer where you have this like, I might be okay. And then we feel better because we
Mhm.
start to let that idea in of like, I am okay. I'm not unsafe. And we see this big shift. But then the next layer of the onion is some other more subtle aspect of ourselves that still is working on feeling okay, right? And
Mhm.
even here, I mean, I've been doing this. I started with my own pain. I mean, and I would say, in some ways, I would say it's resolved too, but it's just not really an issue for me, is more the way to
Mhm.
say it. Because I
Mhm.
still have pain sometimes. But maybe it's like 7 years ago.
Mhm.
And I'm still working on things. I
Mhm.
love the work I do with my somatic therapist. I think I meet with her twice a month. And
Mhm.
each time I feel like I learn a little bit more that supports me more. And so I think, one of the my curable groups members said it's the work of living. Like healing mind body symptoms becomes really it's the work of living. And
Mhm.
I've used that so much, right? Because we're human. We're meant to be moved and moved by things, and we're meant to move our bodies. And so things happen. They
Mhm.
continue to happen in our lives.
Mhm.
And the more we get to know ourselves, the more we can help ourselves through it. But that's, the next layer of the onion. It's the work of living,
Yeah. And
really.
so couple other topics I want to hit on, and then we'll start answering questions. And so for those of you who are listening, I know at least one person has raised her hand, which we should be able, if you raise your hand, we should be able to call on you. You can ask your question out loud. There also should be a Q&A button if you want to type a question. That should get to us as well, and we can read it and answer it also. And so Michelle, thinking about what we're talking about, that physical symptoms don't necessarily mean physical problems, and how we all make that shift. And you and I are talking about how we make that shift. Do you have thoughts about like how we don't assume that there's not a physical issue, right? Because that's a question we get
Yeah.
asked regularly. Like, how can we be sure that there's not a physical issue that's causing the problem? What makes us think that it's the work of living and not the work of medicine that needs to be done?
Yeah. Yeah. I mean, I think I've really started to lean into the idea of, is there something dangerous that if we don't uncover, you're going to have a problem, right? So we
Mhm.
need to make sure we're on top of that.
Yeah.
Um, and And also, I mean, I have some mixed feelings about this, and I'm curious how you feel about it. But I think there are times too when we can use the skills of medicine, physical medicine, to provide reassurance, right? I think
Mhm.
Charlie Merrill talks about this, and I really like this, where he says, I can show people what's happening in their body as a way to say, this is your body's healthy here, right? So we
Mhm.
can use tests also to reinforce this is in a normal range, you're really healthy, which I
Mhm.
think is a really good message too. But kind of always within that framework, right? Of if
Mhm.
we're worried about something physical, that's usually when someone comes to a doctor, right? Or a clinician.
Mhm.
And so we need to rule out things that are dangerous or could be dangerous for them. But once we've done that, there's really no harm in working on it from a mind body perspective and seeing how much improvement we could get as long
Mhm.
as the person feels on board. So that's
Right.
kind of how I think about it. And I know, we were talking about this, but I also lean into my team, right? Of like, is there something you think we should be looking for? And Dr. Stracks and I work together on that. And I think that's really helpful and wonderful about Cormendi too, right? We can lean into the physical, and I can ask him about things, but also then we have psychiatrists and people I can ask about other aspects of that person too, and get
Right.
input for wellness as well. Yeah.
Right. It's, and you and I were talking a little bit earlier today, like there's just, there's always, if you get on the medical train, there's always one more test to run. There's always one more
Hmm.
specialist to see. There's always another referral that's out there. And I think that's because everybody's so steeped in this biomedical model. And so
Hmm.
everybody's assuming that if somebody's feeling poorly, it's because something is physically wrong. And so if another physician or PA or NP can't find it, for many of them, it doesn't click in to say like, hey, tell me what's going on in your life. Tell me about the relationship with your boyfriend. They're
Hmm.
thinking, I can't find it. This really hurts. And so there must be something really wrong.
Right.
And
Yeah.
and now I gotta like help them find it. So I guess this would be the next step as a test, or this would be somebody else in the community who I think might be helpful. And it just
Hmm.
keeps going and going and going. And so if we're going to heal, we have to be able to hop off that train somehow, which I think is scary to say
Well,
like,
it's not, yeah, and it's not the message we get, right? I think even
"Hmm,
as patients, we're used to the model of assessment and diagnosis, right?
Hmm.
It feels
Hmm.
more comfortable and understandable if we walk away with a diagnosis, even if the diagnosis doesn't positively influence what our treatment options are, right? I
Hmm.
mean, we see
Hmm.
this with fibromyalgia. You walk away with that diagnosis, and it doesn't give you any information about how to help that person if you're just working from the biomedical model. But I think in a way, patients, I wanted that. I wanted a diagnosis for
Hmm.
everything that I've
Hmm.
experienced in my body until I really started to lean into the idea that my body knows how to be well if I just give it the right conditions,
Hmm.
right?
Hmm.
And I still always still check off, is there something dangerous here if I don't take care of it, I'm going to actually be in trouble.
Hmm.
And if a physician doesn't know how to answer that, I'll probably go to a different physician. But
Hmm.
that would be the only reason that I'd go to someone else again,
Right,
for more.
right.
But usually that kind of catches a little bit more kind of biomedically focused clinicians,
Mhm.
kind of in their own game, essentially. It's just what our skills are, right? Is assessment and
Mhm.
diagnosis. And when you
Yeah.
ask that question, is there anything dangerous going on, or is there something that could be dangerous going on that we need to look
Mhm.
for?
Mhm.
It really starts to focus the treatment or the workup of like, yeah, we don't need to go down that rabbit hole. It's actually not something that's going to influence our treatment, or it's not actually dangerous. It's just going to
Mhm.
scare the patient more, essentially. And we can
Yeah,
work on this from a different perspective.
yeah.
But that doesn't often happen.
Right. And if symptoms are related to the brain's assessment of danger, I mean, I say this pretty regularly, like there are very few places that are more dangerous than the medical system.
Oh God.
It's a lot of
Mm.
messages of like, this could be bad, we don't know, we're not sure how you're going to get better, this could be like this for the rest of your life. You've got this new Mercedes, but now it's got a key mark in it, um,
Mhm.
all those statements that people will make. You said a minute ago that you started to recognize that your body could heal given the right, I don't know how you put it, ingredients or situation or
Yeah. Yeah.
factors. What kinds of
Conditions.
things? Yeah, thank you. What kinds of things, what kind of conditions are there? Like, how do you think about what your body needs in order to be its best self?
Well, this connects a little bit to what you were just bringing up, and we had talked about before with one of our patients, where the messages we get from the biomedical community mostly are pathologizing, right? We don't really hear from our clinicians about the things that are going well. We hear about the things that could be bad. And so I think that's kind of the first thing is just recognizing in a way that that's their job, but that's not the only message, right? Like there are other messages I can take in about my body.
Mhm.
And I think that's important. And then, it's really funny. I don't know if you read How Emotions Are Made,
Mhm.
but
Mhm.
it's this, if any of you out there have read it, it's this like incredibly complex. She's talking about how the brain works for like 9 chapters or something. And it's like, I had to pause and take it in and repeat. And it was heady. And then she gets to the, what do we do about this? And it's like, eat well, sleep well,
Mhm.
exercise, right?
Mhm.
These things that we've been
Right.
saying that we know about wellness.
Mhm.
And so, and she was talking about how that supports our emotional well-being. And so sometimes it's those things. I talk to patients about this where we might think we have a problem, especially if we've gone to a physician who's kind of ready to diagnose. We'll come away with a diagnosis that feels like a problem. Um, and then we have to fix that problem. We have to figure out all the ways to fix ourselves.
Mhm. Mhm.
Um, and that, if anything, just kind of heightens the fear,
Mhm.
right?
Mhm.
Um, and that message doesn't really help. So, but anyway, when we have a problem, we generally go into trying to fix. And what I often tell people is let's put fixing aside for just a moment and work on just caring for you. What's going on in your life? Is there a way we can show up more for you and promote your wellness essentially? And even in the moment, like these are things where like if I'm really overwhelmed, I know I actually just need to do a little bit of a yoga practice, and then maybe I'll go back and try to fix that problem, which often ends up not being anything that needs to be fixed once
Mhm.
I actually just feel better.
Right.
So that's kind of what I mean. In somatics, we talk about giving someone setting up the right conditions for the nervous system to come back into regulation.
Mhm.
And that's what we kind of miss, right? We go right into fixing. It feels scary. I have this new diagnosis. I have to do all these things.
Mhm.
And our state while we're doing those things is just through the roof. I mean, I was led by fear for 3 years and I felt fear all the time with my body.
Mhm.
And when I actually just started doing things that helped me feel better, just me, not my foot, just me, that's when I started to
Like,
get better.
like what?
Yeah. Well, I started swimming.
Mhm.
I also I started just doing things I love.
Mhm.
Um, I used to always say things like, "Oh, I don't even know if I'm going to be able to keep my job anymore because I can't stand on my foot for this long." And I was thinking about that all the time, all the things I couldn't do. And
Mhm.
instead, I just started to do the things that I could do.
Mhm. Mhm.
Um, and I was at that point had already had some experience with yoga, which you guys would hear about in my interview with Dr. Stracks, where I had pain go away after doing a particular type of yoga practice. And so I was leaning way into yoga. That's when I became a yoga therapist and I did 1,000 hours of training in yoga and mindfulness and these things that just deeply fulfill me. And was started to get better. Um, so, in a way, it's kind of putting away the need to fix the problem and doing the things that just help you feel better, like sleep and exercise and food, right? I talk to people about that when I coach them. How have you
Mhm.
been sleeping? What are you doing with your food? Is there a way you can shift to support yourself more? And then oftentimes they'll feel better and their symptoms will get better too.
Yeah. Do you think you were the only plastic surgeon in Chicago who was also a yoga therapist?
I think probably yes. But I'm not a plastic surgeon anymore, right? So that shows something too. It was great work. I loved doing breast reconstruction, but um, there wasn't a lot of room for these types of discussions,
Mhm.
and that was hard. I think if someone comes in to a surgeon's office, they're expecting a really focused discussion about their physical
Mhm.
body, and
Mhm.
I saw so much more than that, and
Mhm.
there wasn't necessarily a platform for it.
Because
So
you, I mean, you said work with a lot of patients with breast cancer, and what's
yeah.
more vulnerable than having a cancer diagnosis? And you and I had talked about that at the time, that a lot of women coming in who sort of very scared, very
Mm-hmm.
unsure what was going to happen next. But as you said, sort of without thinking that they're going to then talk to their surgeon about what's going on in their lives, what these fears are, those conversations didn't necessarily happen, and a lot of pain, I think, that went with
Yeah. Mm-hmm.
diagnosis.
Yeah, and I think there's still room for, I mean, for the clinicians out there, if there's anyone watching who's a clinician, there's still room for making those shifts, right? Even just having a calm affect and a calm presence and facing someone and being with them and those things I think really made a difference. But there were still things that, I don't think, I think a lot of patients aren't expecting that if they go to see a medical doctor anyway. And I
Yeah.
think it's important that we start making room for that. You've been in integrative medicine, so maybe there was kind of more of a platform most of the time, but it's not, surgery is a different animal for sure.
Yeah.
So,
I really,
yeah.
I don't even know that I've focused so much on the fact that, I mean, I know that you're not doing plastic surgery at the moment. I think you still were when you moved out to Colorado for a little
Mhm.
bit, but I really admire your ability to kind of follow what you believe at this point. And because I think you really liked plastic surgery, and I think you were really
Mm.
doing a lot of good things for people in that practice, and for you to be able to say, like, this is where I feel called to help people. It's hard.
Yeah.
You were in that field for a long time.
Yeah, it's definitely really hard to walk away from, and then also so fulfilling with what I'm doing now.
Mhm.
And I think, we don't know enough yet, but I tend to think that this wellness aspect and knowing that the body can and is good at being well is a message that's just so important. And it really is the root of, we're not really good at managing chronic disease even. And
Mhm.
so what if we were doing more of this?
This
I think
the
we
being the medical system doing more of
yeah.
this you're talking about, yeah.
Yeah, yeah. So it's a message I think, I gave a lecture at the PA school. I mean, it's a message I just can't stop talking
Mhm.
about. So,
All right, I want to take questions just a sec. I
sure.
know we've got a few that have come in the Q&A, and Hillary's got your hand up, so bring her on in just a second. Before we do that, I want to talk about yoga for just a minute, because I know I've been doing a lot of yoga, and you've made yoga part of your personal healing process and you incorporate that. Um, any thoughts about what makes that such a good adjunct for you in what you've experienced?
Yeah, I mean, I think people fall into things, and I'll be totally honest. I started doing yoga because I wanted to work out,
Mhm,
but
mhm,
then it really helped me in other ways. I always felt really calm after yoga. I think about this. I think mindfulness is really the root of yoga. Self awareness is really the root of yoga. I mean, I think the yoga we know in the US is much more about exercising, but if you get more into it, that's the stuff that starts to come in. And that's so much of what we're asking people to do in mind body healing is what's
mhm,
going on for you? Is there a
mhm,
way we can support you better or you can find to support you better? And yoga kind of offers a path for uncovering those places that need more care.
mhm,
It also offers like immense number of regulation practices, right? It's just like got that dialed. And so I think that's amazing. And the other thing too is somatics. I think the mindfulness is kind of the basis of somatic work too. If anyone out there has worked with a body psychotherapist, there's a lot of mindfulness in that. And
mhm,
I've started to really hone in on the idea that mindfulness is kind of the base skill for neuroplasticity, for harnessing neuroplasticity,
mhm,
where you're going to guide your mind towards something that your brain can then learn something new. And that's what we need to do to shift patterns. So I think, yoga kind of, I almost fell into it.
mhm,
But it was so noticeably helpful. And then my healing experience, I guess you could call it, or the time when I had a really big shift in my pain was related to yoga. And so it just like totally captured me.
mhm,
Um, and and I think I told you this, but Dr. Stracks and I were both in SP training. It's a type of psychotherapy training. And I went to that and I was like, they're basically teaching yoga. They're
mhm, mhm.
teaching you to bring awareness to your body. And so I just think it's kind of been the thread that's gone through most
Yeah.
of the healthcare I've been drawn to.
Any thoughts about, so this is the last question for you. Any thoughts
Mhm.
about somebody who's got a lot of pain and so the yoga is uncomfortable no matter what position they put themselves in? Any thoughts about how somebody would start doing that when it's uncomfortable to even begin?
Yeah, well, I mean, I'd need to get creative with them. There's some basic ideas. I talk to people about this, about like if sitting's difficult, let's start with a walking meditation, or let's find a different posture that brings you ease. Or I'll just even have people lean into pleasant sensations when they do happen. And this is kind of an entry to yoga, even though we think of yoga as like doing a handstand or something that looks like a pretzel. But it's it's very still very in alignment with yoga. And then, if we can start to get curious too about pain versus danger, I think that really opens doors with yoga as well, right? Where we can make choices to
Mhm,
move towards more ease and
mhm,
safety in the body,
mhm,
even if pain is present. And
mhm,
that's actually a way that we really retrain the brain too, right? We do activity or some type of movement paired with messages of safety. And that's when, we can retrain the brain. We can let the brain learn something new. And so I don't really tell people to avoid pain in yoga.
mhm,
I
mhm,
tell them to move towards ease and safety. And I
mhm,
think
mhm,
that shift is really important. It's kind of the key to using yoga therapeutically, because that's actually how your brain learns something new. If we avoid pain all the time, we just
mhm.
learn that that thing's not okay for us.
Right.
And so yoga encourages mindfulness and personal awareness, which helps build the skill of moving towards safety.
Mhm.
Um, but we could apply that to any movement.
Right.
It
Yeah.
doesn't have to be a yoga asana.
Yeah, it's interesting that you talk about that. I've done a lot of yoga. I did a lot of yoga in my 20s and then not so much. And then again, now that I'm in my 50s. And it was pandemic when I realized that it's like, oh, there's all these yoga classes online. I don't have to get anywhere. I can just get up at, whatever before everybody else gets up and take a full yoga class. But at the beginning of pandemic with all the sitting and the stress, like I wasn't feeling great. And so I would do gentle yoga classes, and sometimes just the emotions would come up, and I'd like move into a posture, and then there are the tears.
Mm,
And that happened on a number of occasions. And then as I've done more of it, I've sort of like kept shifting gears. You and I have talked about this, that
mhm.
like more active yoga. And then I signed up for power yoga for the
Yeah.
past 3 months. And so like I'm dripping sweat at the end of it. And
Yeah.
it feels great. But you're right. Like there's a lot of discomfort in
Mhm,
those poses, but the sum total is really fun for me at this point.
mhm,
But
mhm.
it didn't start out like that 3 years ago.
Yeah. Yeah, and that's what's really great about yoga. It's really modifiable. There's lots of variety. It's not like running, let's say, where that's a hard
Mhm.
jump, I think, for a lot of us. And yoga can meet you where you are really so well. And so then you can get into the practice where you're sweating and really feeling like you're getting a workout. And you can also lay on the floor and let some tears fall. And, it's all part of it, which is
Yeah.
great.
Yeah,
Yeah.
absolutely. So, all right, let's spend the rest of the time. There's some questions that have come in. Some questions got emailed to me earlier today. Hillary, I'm gonna try to open your microphone. You've got your hand up. Let me see if I can do that. And um, and you can ask your question.
Am I unmuted? I'm
We
sorry.
gotcha.
I did not mean to raise my hand. But now that I have, I want to say hello, Dr. Stracks. This is Hillary Rollins, an old patient of yours,
Uh-huh.
still on this train. Happy to be here. I'm not going to ask questions. I'm going to let people who need more information to ask
Sounds
questions.
good. Nice to see you, Hillary. Thank you. So, all right, let me Michelle, read some of these questions that have come in. Having experienced
Okay.
chronic pain, any new pain immediately generates an expectation that this new issue will follow the chronic pattern. I've learned that this reaction kicks in almost unconsciously. What would you recommend to interrupt that pattern? Um, and so it's been a lot of years, and any new symptom will sort of move into that pattern really quickly. Any thoughts about how to interrupt that pattern?
Well, I guess what I'd first probably inquire about is how you moved through those chronic symptoms in the past, because it sounds like, and I'm kind of making an assumption, but something comes up, lasts for a long time,
Mhm.
goes away, then a new thing comes
New,
up,
yep,
lasts
a
a
new
long
one comes
time.
up. Yep.
Yeah. So I probably, I think I'd lean into, first of all, the idea that you've had this happen before and it's gone away. So that can be encouragement. Alan Gordon talks about the three stages of a flare up, which I find really interesting. And the
Mhm.
first is like, I think he uses the word freak out. That's a word that resonates with me. So it works for me. But the freak out stage of like, oh my God, this can't be happening again. The second stage is kind of like pushing on the strategies, that worked last time. And there's like a really big level of intensity about that. And then the third stage is wait, I know how this works. And he's really big on kind of the stuff that I'm interested in, which is, again, coming back into wellness, into ease, finding the things that really support you. So
Mhm.
I think first kind of acknowledging that that's going to be a part of any time a symptom comes up. I mean, I just acknowledged I've pretty much gone through that with every mind body symptom that comes up for me, but it's shorter each time.
Mhm.
I mean,
Mhm.
so much
Mhm.
so that my boyfriend says, "What's the catastrophe of the month for you?" And I have to be like, "Stop it." um, but it still happens. And so, kind of acknowledging that that can happen, you can recognize the pattern. So, that's a big deal, right? That's a
Mhm.
really big deal. And then acknowledging that there's going to be these stages and then letting yourself settle back into what works. And if you're not sure what works, you could come to one of us and we could talk through it and say, well, what did happen, or what is going on with you, and we can work on strategies with you. But I think that's really common. That's how our brain works. It's really good at doing the same thing again because it's less energy consuming, and but you're already recognizing, so that's a really big deal. And again, like I said, if you can't figure out what kind of helped you get out of it in the past, we can probably help with that too.
Yeah, this concept of neurotags that Lorimer Moseley has, that nerves that wire together fire together. And so our brains get, like you said, we get really good at making that connection that, oh, here's a symptom, what's wrong? How do I figure it out? And will it be here indefinitely? And so just recognizing that and learning the signals. I know one of my patients said one time that she knows she's angry when she hears herself in her mind saying she's not angry. Finding
Finding your
And
cues, right?
yeah, and I've learned over time that like when I start to get really irritated about something that like we're doing here at Cormendi or I'm working on, I know I've learned over time that that's a sign that sort of things are shifting and there's going to be a breakthrough. And so starting to recognize those patterns and being curious about them and not assuming that like what we're telling ourselves in our head is going to be the outcome. And so I think that
Yeah.
sometimes helps to make these shifts more quickly and easily. Next question, being stuck. So utilizing Dr. Sarno's philosophy to solve back pain, is pain-free for 25 years, but now shin and hip pain for 6 years, done Dr. Schumacher's program, Nicole Sax's program, Alan Gordon's book, Pain Psychology Center. I'm very preoccupied with the pain, which I know is not good. If I can still exercise and meditate, any suggestions?
She said she's preoccupied with the pain, but she can still exercise. I can still
Yep.
exercise and meditate.
Yeah.
Um,
And so there's another question that came into me through the email, which is very similar. I've done, the other person wrote, I've done everything and I'm still not getting better. So what makes some people
yeah.
stop and what makes some people able to break through? So both of those questions are similar.
Yeah. One of the things that comes to mind is, and I think we've talked about this before, Dr. Stracks, but this kind of idea of a to-do list or like a self-care list that becomes like a to-do list
Mhm.
versus a being list or an ease list, which is how I've started to talk about it. And
Mhm.
sometimes our self-care or the things we're doing to be okay can
Mhm.
actually be what kind of fuels our continued I'm not okay feeling. Like, I'm not okay unless I do this. I have to
Mhm.
do all these things to be okay.
Mhm.
So that's maybe what I would get curious about when someone's feeling a little stuck is, we talk about this a lot in yoga. It's not about the movement as much as about the approach to the movement.
Mhm.
And sometimes I find that in healing too. If our approach to healing is from a place of I'm not okay,
Mhm.
um, then all the things we do in a way kind of reinforce that. It's tricky. I'd love to have you say words on it too. But what I often come up with people is like, what actually just really nurtures you, right? I had this woman, I said, what's on your self-care list? She listed acupuncture and I go to massage therapist, all these things. And I said, well, what is it like when you go to the acupuncturist? She's like, oh, I hate it. I have to fight traffic and it takes me an hour and a half to get there. And I don't even really like the room that they put me in, and they just changed their strategy and all these things, right? But that was her self-care. And
Mhm.
so we kind of started talking about what really would just feel like, ah, and just to at least give a little time to that daily.
Mhm.
But, there's also other answers like, let's maybe try a different approach. That's something I talk to people about too. It just kind of
Mhm.
depends on what's going on with them.
Right.
Um, so I don't know. How would you answer it, Dr. Strax?
Well, I think that, there's stories out there, right, of people who just get told that their pain is not physical in origin and then they're better. And so there are people who seem to be able to do that. I haven't met a lot of them, maybe because they wouldn't make an appointment with me if that was their experience. And then there are other people who learn about the nature of pain, like they learn it and then they learn some information about the nature of pain and they're better in a few weeks. But again, I feel like that's not the usual course of things. You and I were talking about this earlier, that frequently like there's work that needs to be done. And so I think that when we get into a bad pain cycle, oftentimes it's our body's way of saying we need to do something different than
Mm-hmm.
than what we're normally doing, and we need to move somewhere different. And you and I have both had a version of that. We were saying for you, you had this pain issue in your foot that eventually is, got solved or is a lot better. And that helped push you from one career really into a new career, right? You had things to do, and the pain helped explain that for you. And I had a similar experience of I needed to be here doing this work. And so I had this experience to show me how that worked. Not everybody has pain issues so that they can then go teach this, but frequently it's a sign that something needs to shift. I think the example of you and the IBS is a great one because your body was telling you something clear about that relationship. And that's a hard one, right? Like I said, I don't like to prescribe that to somebody. I wouldn't say like, hey, I think you should break up with your boyfriend. But sometimes there are very difficult decisions and changes that we need to make in order to really feel like we're getting better. I am going to share my screen for a second. This is on our new blog website, so drstracks.com. But I think it's now 10 reasons for pain and other chronic symptoms. And so this is a list that I go through with people, especially when they're stuck and it's not clear what's going on. And so the number one reason people get stuck is not understanding the nature of pain. And so I like to sort through, do people understand this? Do people understand where it's coming from? Number two is emotional. And so keeping our emotions inside, not knowing how to get them out. Three is stress, both in the present and in the past. Four are these aspects of personality that many of us know about. So perfectionism, people pleasing, catastrophic thinking, being highly self-critical. And so those can be strong reasons for pain, and that can be what the pain is pointing towards. Not understanding what we're talking about in the moment, that the symptoms are not the enemy, but the symptoms are pushing us somewhere or directing us somewhere. And so making sure we understand what the symptoms are telling us and not sort of with this energy of, I just need it to go away. Because if things that would just need to go away tend to push back really hard. Depression and anxiety are their own category of reasons for pain. These interpersonal areas, and so here's the relationship and communication that needs strengthening, social support that's not there, inability to set boundaries. I'm working with a couple of patients right now on the need for forgiveness, and that's what's keeping them stuck for the time being. Parenting is its own category. And so that's not having enough time for ourselves, or parenting a child who's got neuroatypia, or parenting a child with physical or mental health issues. And those can be really difficult to know how to sort through and resolve. And then finally, if there's no other answer, it can be this never-ending cycle of being worried and trying to sort through what to do and not getting the benefit and getting more frustrated. And then it keeps cycling like that. And so I tend to try to go through that particular list, and that either is on our new blog or will be there very, very shortly so people can access it. But I try to go through that and think, okay, if these symptoms are strong enough that they've been around for years and they're not budging, is there something fairly significant that has to shift, that the symptoms are asking us to shift? And I also say regularly to people that if the pain is so significant that it's almost unbearable, frequently I will assume, until proven otherwise, that there's a strong emotion that's present that needs release somehow. The most dramatic story I've ever heard is a patient who was a patient of Dr. Sarno's in New York and did really, really well for 25 years, and then had called me at the beginning of the pandemic and said had significant back pain. And they said I thought it was pandemic, and no, I don't think it was. And so they messaged a week later and said they'd had to put their dog down, which I had known was a possibility, and that the moment the dog's head hit the table, burst into grief. The grief exploded out of her, said, and the back pain went away instantly. And so it's this intense, intense, intense emotion in physical form that when became an emotion, the physical symptom was gone.
Mm-hmm. Yeah.
Uh,
Yeah, I've started to ask people even too, how does it feel to consider this as just an expression of emotion? Just the same way our cheeks flush if we're embarrassed, or our stomach feels queasy when we're anxious. And I think sometimes that takes the pressure off of like needing to figure out
mhm,
something else about it, right? The physical part can be scary just because it's physical, but we're
mhm,
all pretty comfortable with the idea that our cheeks can flush when we're embarrassed, or our stomach
mhm,
can
mhm,
churn
mhm.
when we're nervous. And so if we just kind of turn to it like, oh, I must be having an emotion because I'm feeling this sensation,
Yeah,
um, we can work with that then.
yeah.
Yeah.
A couple more questions and then we'll sign off. Bad pain, bad anxiety. How do you break the cycle between the two of them? The pain causes anxiety, the anxiety causes the pain to get worse.
Yeah, I think I tend to focus on the anxiety then, and I'm body based, which I think is kind of coming through. So I work on a lot of down regulation strategies with anxiety, and I think too, different approaches work with anxiety. That's why it's so great to have a team at Cormendi.
Mhm,
Um, but I use a lot of somatic resources to help with anxiety, and when we start to feel like we have a little bit of confidence that we can shift the symptoms of anxiety, I think that's when I start to see shifts overall too, like the confidence that if this happens, I have a strategy that I know helps me,
mhm,
where then we don't get kind of caught in the fuel that can happen with anxiety, where we start to feel it and it just takes
mhm.
off.
Right.
So I do a lot of those things. We have a resource at Cormendi for somatic resources, things like grounding, feeling your feet on the floor, different breath work practices. So I would probably start with the anxiety rather than trying to target the pain specifically. We can kind of
Mhm.
think of them as equivalents almost, and targeting the anxiety might be more impactful.
Yeah. And then I'll just add just a little bit to there. And this is a diagram that I will use regularly, which is that we have feelings, and unless this is what we're talking about, the language of emotions and the other. So unless we're really good with feelings, the feelings will raise anxiety in us, and anxiety is not a fun place to be. And so in order to manage the anxiety, frequently that's where the symptoms will come from. And so we've had feelings, unless we're really good at getting them out, we get uncomfortable with them, don't know what they are. And so then they create symptoms. And then over time, because our brain gets good at this, we can go straight from having the feelings to having the symptoms. And then as we learn about this and sort it out, if the first thing that happens is we make this connection and the symptoms start to calm down, at least temporarily, like there's the anxiety as the only strategy for dealing with this. And so
Hmm.
we need to continue to go backwards and figure out how to deal with these strong feelings that many of us were not taught to deal with
Hmm.
effectively when we were young. And so I think that oftentimes is the connection between the anxiety and the symptoms. They're actually coming from a similar place. And that's why it can go back and forth between the two. So much so that I've had people who have had symptoms get much better, and then their anxiety gets so bad that they tell me they want the symptoms back because the anxiety is more uncomfortable.
Yeah, I've seen that a lot. I've seen the flip flop a lot. And I think that can be disconcerting, right? But then we kind of realize they're coming from a similar place. And I think I think my practice with feelings has really increased in working with Dr. Stracks and with Cormendi. It's a really big foundation of what you do. And the down regulation does that too, right? It helps us kind of come back to wait, what's going on with me? When we're really anxious, we can't really figure out what's going on with us. And so when we work a little bit on that, oftentimes we get more access to what are actually the feelings here, which I see come out a lot when people come
Yeah,
down. They'll say, "Oh, I'm noticing I feel sad, or
yeah,
I want to yell at my boss or something," right?
yes, yes, yes.
So
Definitely.
all kinds of things come out. Yeah.
All right, three more questions. One on insomnia. I have some thoughts about that. Any thoughts about sleep and how to keep yourself out of that loop of like, I got to get good sleep and it's not happening and now I'm feeling worse.
Yeah, I remember you brought up that book, Effortless Sleep Method, I think,
Mhm,
and it kind
mhm,
of fits with my general messaging, which is like your body knows how to do this if we give it the right conditions.
mhm,
I haven't read that whole book, but I know we've talked about it a couple times, and
mhm,
that's kind of where I start with sleep. I'm really big on sleep hygiene for that reason,
mhm,
where we really clear out time and space for things that feel really basic, but like
mhm,
dimmer lights, no electronics,
mhm,
not working for, at least 2 hours before
mhm,
work. I mean,
mhm,
before bed, I would say more. Not eating right before bed. Um, and I think too, what I often see is when you start working on the other things, sleep gets better. So it's not that we necessarily need to work on sleep as much.
mhm, mhm,
Um, it's if we work on what's going on with you and your emotions or your nervous system, sleep gets better. But as a starting place, because gosh, if sleep's not happening, it's just so much harder to engage with other strategies. I really talk to people about sleep hygiene, and
mhm,
again, creating the conditions where your body knows how to downregulate. If we
mhm,
give it, it might take time, and we're not
mhm,
really used to
mhm.
giving ourselves time and space for things.
Yeah.
So that's one way I talk about it. I was an insomniac for a while.
Were you?
Yes, for that was another one of my things. I think, probably 3 years, and
Mhm,
it went away when I started doing EMDR therapy.
mhm, mhm,
Um, but I also had to reframe and say, you know what? Even when I don't sleep, I actually do okay. And so
mhm,
it started taking away some of the pressure. Like,
mhm,
well, I mean, I got through that day. I was
mhm, mhm.
tired, but I got through
Right,
that day. So,
right.
yeah.
Two of my favorite recommendations from the Effortless Sleep Method book, which I do like a lot, Sasha Stevens is the author there. One is to change the narrative. And so we tend to follow our narratives. And so the narrative is about how we're not sleeping and our health is getting worse and we can't do it no matter what we do. We tend to follow that along. And so I do, whether we're talking about pain or sleep, frequently make the recommendation to change that narrative to I'm a great sleeper. I've always been a great sleeper. And I wasn't a great sleeper for a little bit. And I learned how to do it. Now, even if something stressful, I thought, get into bed, my head hits the pillow. And tell that to ourselves and tell that to other people and see if we can figure out how to follow that narrative around. And then the other is to cultivate one or more relaxation strategies that we know we can use when we need to, and whether that comes from yoga or meditation or muscle relaxation, or however we do it, we practice it, we practice it, we practice it. Sasha Stevens says 30 days, like, and the most common mistake is to do something for a couple of days and say, oh, this doesn't work. But to do it for at least 30 days, to do it during the day so we know we can do it well, and then call on it in the middle of the night. And she's got a number of
Hmm.
different relaxation strategies in there that have been helpful for people over the years.
Hmm.
So those are a couple suggestions that I particularly like.
Yeah, I love those. I find if I wake up, I'll say, I'm safe right now. There's nothing I need to do. If I say that to myself multiple times, I drift back off.
Yeah. Um, the last two questions, weaning from medications.
Hmm.
I get asked a lot. Any experience yet in people who are weaning off medications and how they deal with that?
Yeah, I've been doing a lot of learning with you, Dr. Stracks, on this. I have a couple patients who are working on that, and I have found slower is better, right? And
Mhm,
I'm
mhm,
on board with how you kind of approach it with the 10%, decrease each time, maybe even just 10% per month.
mhm,
And kind of the framing of there's no need to feel like we need to do this quickly. I think there can be some feeling of like, oh, I don't like that I'm on a medication, and we kind of beat ourselves up about it. So I
mhm,
also tend to encourage that there's lots of different strategies. Medication is one of those. And so it's not a bad thing.
mhm,
But if it's something you'd like to try to change, slower is better, is kind of how I
mhm.
talk through it.
Yeah. And, when symptoms of withdrawal are bad, and I assume that symptoms of withdrawal are bad, I just kind of tend to pin it on those until proven otherwise. And so I've seen some really brave people wean off a lot of medications, and it can be incredibly difficult as it's going on, but I've also seen people come out in completely different places
Mhm.
once they get on the other side of that. And so it withdrawal symptoms are amazingly difficult to deal with, and they get better. And so I like you, try to just go really, really slowly, really, really patiently. Don't decrease until things have stabilized. And I've seen people get through it,
Mhm.
and so I know that people can.
Mhm. Yeah.
Last question: mouth and gum and teeth pain. Any experience in helping people with those symptoms so far?
I've seen a lot of mouth and teeth pain, and I think um, we have to be careful how we talk about it, but we can think of pain the same, kind of no matter where it is, right? We're always looking for that balance of danger and safety. Of course, we want to make sure there's nothing going on in the mouth that's concerning or dangerous for you. But otherwise, we can kind of think about them similarly. Interestingly, I think tooth pain is something I've found is really connected to stressors. I guess not interestingly, right? We know that about a lot of pain. Um, but yeah, I think we tend to kind of write it off and think of it structurally, I think, because we're using our mouths all the time. I don't know. It's something that I think is harder for us to kind of wrap our heads around, at least the people I've worked with. But I think it's very similar. I've worked with someone who similarly kind of used some type of device that, like, what for cleaning her mouth, and she thought that maybe that injured her in some way. So sometimes you have to wrestle with those things a little bit and kind of again remind yourself of the foundation of what we know about pain, which pain presents when there's a sense of danger in the system, and it can present anywhere in any way. I mean, your mind can make up all kinds of, not make up, create all kinds of sensations. And so we want to remember that and look at it that way as well. And I don't know that. I mean, if we talked specifically, maybe other things would come up, but that's kind of a important starting point for sure.
Yeah. And it's whenever I talk with patients with mouth or tongue pain, like I can feel it in my own mouth, and so I know that those symptoms can be driven by it's a very common experience for me to have, and it goes away as soon as we stop talking about it. But I think those nerves that connect the mouth and the brain are particularly strong, and so
Hmm.
common place that we will get symptoms. I have one patient who had burning mouth syndrome, and we spent a session just allowing her to be angry, and angry at her sister, and just once we allowed the anger to flow, like it's like 45 minutes of just really intense anger at a certain situation. And so I always think about that when there are mouth symptoms. Is there something that needs to be said? Is there anger that's present?
Hmm.
Is there some sort of metaphor in the symptom? And so those are other
Hmm.
things that I think about when people are dealing with that particular symptom. Uh,
Hmm.
let's see, there's a message here thanking you for the work that you do and how helpful it
Hmm.
is for people who are struggling with this. And one last question about the where to find the document that I shared. And so I'm going to share my screen one more time and show off this new aspect of our website. And so this is the educational side of our website, designed with the help of Lisa on our team. And so drstracks.com, in the blog area, if you scroll down, there are a number of blog posts, and this will continue to get built out over time. But the one I shared is down here: 10 reasons for pain and other chronic symptoms. We added one over the year since I wrote that. So we will wrap up there for the evening. Michelle, thank you for joining me this
Yeah,
evening.
thank you.
You are in our our electronic office on Wednesdays and Thursdays.
Hmm. Hmm.
And people can, if they're interested in working with you, what kinds of things do you really like to do with people? What are some of your favorite appointments to have?
Yeah. I do coaching and I love coaching, which I think is kind of like setting the framework, reinforcing the framework, getting curious about what could be contributing. And then I like to do somatic coaching as well, which is a little bit more focused on what's coming up in your body, what might your body be showing you, how can we work with that. I kind of spoke to this a little bit, but some of that's regulation and some of that is what I call stretching, which is kind of going into what the discomfort is and trying to figure out more about it essentially and experiment with it. So I do both of those things. And I do lead some classes as well. I think we have the nervous system classes coming up in October.
Mhm.
So if you're interested in learning more about the nervous system, that class will be introducing kind of how we experience the nervous system through the body and how to work with that in a little bit more detail.
Right. And you are in the office this week, but I think out next week because there's an event coming up. Is that correct?
I thought you might bring that up. I'm getting married. Yes. So I'll be out next week, doing a lot of family stuff, putting on this like special dress, I guess, and and doing that whole thing. Yeah.
Congratulations.
Thank you. Yeah, I'm really excited.
So we will end there. Thank you to all of you who have joined us. We will, this has been recorded. We'll post it on the website within the next couple of days. So anybody who wants to share it or watch it again, it will be available. I hope everybody has a good evening and we'll see everybody soon. Thanks, Michelle.
Thanks, Dr. Stracks. Thanks, everyone.